Hey everyone, me Kevin here. I've been continuously concerned about what is happening with COVID and what this is going to mean for our finances, especially those of us who invest in stocks and real estate, especially with the fact that stimulus has all but dried up. Hopes of stimulus are totally up in the air, and now we're thinking, oh my gosh, what if we start having lockdowns and no stimulus all at the same time? It would be a disaster. So I've been watching a lot and reading a lot about the COVID situation, and I wanted to share this particular interview with former FDA Commissioner Dr. Scott Gottlieb. I want to share with you what he says about stimulus and what he says about lockdowns, and of course what he says about COVID. So obviously most of this video is going to be about COVID and lockdowns, but his suggestions on stimulus actually came from a place that I was not expecting. So let's take a look at this video and see what we've got. I think it's very insightful, and so if you appreciate this kind of content, make sure to subscribe. I try not to spam a ton of these videos out, but when I see something like this that's insightful, I do like to bring it to you. So let's go ahead and pull up the screen and let's hit play. Just as long as you get your 3 free stocks with Webull when you deposit $100 via the link down below, worth up to $1,600. Hey, that's free money. And of course, get life insurance in as little as 5 minutes. Getting life insurance in a pandemic, you can Apple Pay and Android Pay for. You can do via the link down below. All right, here we go.
We turn now to former FDA Commissioner Dr. Scott Gottlieb, and we want to thank you for being here in person. You've been tested, I've been tested, you're at a distance, so hopefully you approve. I haven't seen you in person since mid-March, but things haven't gotten better. In fact, they seem to be getting worse and accelerating in the infection rate this week alone. I mean, the numbers are pretty staggering. The president.
And this is important, right? The infection rate. Of 100 people who are tested, what percentage are positive? When that goes from 10 to 20, we have doubled our infection rate. So this is ignoring just sort of the nominal case counts. Nominal just referring to the overall number, not saying cases are nominal. Anyway.
Continues to say we're rounding the corner. That's just not factually accurate.
No, things are getting worse around the country. I think Thanksgiving is really going to be an inflection point. I think December is probably going to be our toughest month. But when you look at what's happening in states right now, you're seeing accelerating spread. We're right at the beginning of what looks like exponential growth in a lot of states, the Midwest, the Great Lakes region, even states like Texas, where you see 6,000 cases, Illinois, 8,000 cases, Florida, 5,000 cases, Wisconsin, 5,000 cases reported Friday. These are very worrisome trends.
I want to quickly interject and just say, I've been anticipating that we're going to see a surge in cases here in November, and I've been suggesting we could easily see 150,000 cases per day, maybe even as high as 200,000 cases. This was back when we were at 50, 60, 70,000 cases a day before we even got close to 100. But I really thought that maybe November would be the rough time. Then we would see governors come down with some sort of restrictions and lockdowns, or hopefully, something we can all bear with. We can debate lockdowns separately. Let's just focus on what Dr. Gottlieb says. But I thought maybe November would be the worst. Dr. Gottlieb here is saying that Thanksgiving, which is on the 26th, could be the inflection point to where it gets even worse. And I'm not expecting the next 3 weeks to be good. That means December and Christmas could be very brutal.
There are about 23 states right now that are accelerating the spread right now. The positivity rate is above 10% in 15 states, and all the states have an R above 1, which means that they're an expanding epidemic right now. So this is very worrisome as we head into the winter.
Actually, that was acknowledged in a pretty frank interview by Dr. Fauci with the Washington Post that published yesterday. He said neither he nor Dr. Birx from the task force have briefed the president in quite some time. He said that's because the White House didn't like the news. They needed to have a medical message that was essentially consistent with what they were saying. That's pretty.
I want to clarify that. I mentioned this interview actually this morning in this morning's lockdown, COVID, and stimulus update. I mentioned that Dr. Fauci said, hey, this is getting very bad, and we have a recipe essentially for disaster here. The White House came out and said, hey, basically, Dr. Fauci, you're out of line. This is not consistent with our message and our strategy. And they scolded him for that pretty hardcore. And remember, when they talk about this R0 figure, just really quickly, when you hear that, it sounds complicated. Basically, number over 1 means pandemic growing. Number under 1 means pandemic shrinking. And we're over 1.
Flat out saying that medical information and the public's health is being played with for political purposes. Do you agree with that?
Well, look, I think the facts are going to overtake any political dialogue very quickly. I think as we get into the next 2 or 3 weeks, it's going to be unmistakable what's happening around the country, and we're going to have to start taking tough steps. I don't think we're going to lock down like Europe is right now.
And this is interesting. This is when I started really paying attention to this interview, because I thought to myself, wait a minute, Europe is locking down. They said they were not going to lock down. The UK said this. We've heard this so many times. We're not going to lock down again. We're not going to shut down again. And here we go. France, Belgium, Austria, Germany, the United Kingdom, specifically England, locked down again. Cases in Sweden are spiking. Sweden's supposed to be the sweetheart of Europe that had COVID totally under control. And they're all spiking. The other ones I mentioned are locking down, at least partially.
Europe has a very dense epidemic. There's a very worrisome trend underway in Europe.
Europe didn't think they were going to lock down either, and now
that is true, but I don't think the political support is here for that, even at a state level. I think you're going to see targeted mitigation. States take local actions.
Okay, sorry I keep pausing. I just want to say here, another thing we've talked about is that we look, Donald Trump is going to be in control, and they'll be talking about that in just a moment. But Donald Trump's going to be in control between now and January 21st, at the very least. No matter who wins, Trump is in control for the next 3 months. So the reality is, my thinking was, well, Trump's not going to lock down. Governors might. So we might see, here comes, New York locking down again. Jersey's already talked about starting to lock down again. California, which was one of the first to lock down, might lock down again. This is an interesting argument, though. He says it's not going to be likely that politically people will allow there to be lockdowns again. And I think we all agree. We're tired of lockdowns. We want to go outside. We want to be able to live. So let's see what his recommendation is here and how this relates to stimulus.
But we're going to have to start taking more aggressive actions. Probably, my view is the inflection point is going to be Thanksgiving. You're going to see cases build over the next 3 weeks, and December is really going to be the slow month. But I think it's going to be unmistakable what's happening at that point, and we're going to be forced to, because the hospital systems are going to become pressed again.
When he says the slow month, he means the month to slow the spread. That is, we're going to have these insane cases leading, or basically going through November, to where when we're in December, states are going to be like, oh crap, we need to handle this. The nation's not going to lock down, so every state's governor is going to have to slow the spread.
Regardless of what happens in this election, the president is still the president until at least January. If he wins, he owns this through a second term. What does he need to be focused on?
I think he needs to be focused on providing resources to states. They have to get a stimulus passed. They've got to get funding out to states to try to deal with this. I think we need to focus on what we're going to prioritize in terms of trying to keep things open and get things open after we're through this, particularly the schools.
Gonna pause here. So here's our mention on stimulus, and this is actually really interesting. What he's saying is, pulling together some of the things he's said so far, which is entirely different from things that we've heard before. Europe, it's okay, lockdown. In other sides, we've heard, well, let's just wait for a vaccine. It's coming soon. Moderna is expecting to have some vials by the end of the year, and then many more by the first quarter and second quarter of next year. That'd be wonderful, as long as the drug actually gets approved and is deemed safe and effective. But let's pull this talk together about stimulus. So Dr. Scott Lieb is saying, look, we're not going to have a nationwide lockdown because the people won't go for it. Maybe we'll have these statewide restrictions, but the reality is it's going to come down to a local measure. Remember what one of the big sticking points has been on the stimulus discussion: state and local money and funding. We'll go back to this interview in just a moment. But state and local government funding provides resources for testing. Why is it that South Korea provides safe, anonymous, and free testing? It's so that they can track where problems are actually occurring and shut down the virus. However, Nancy Pelosi and the Republicans, Mnuchin and Meadows, can't come to terms on state and local government testing. Now we're starting to get health experts coming out saying, we need to provide stimulus specifically for state and local governments, so that way we can arm them and let them deal with the pandemic mitigation controls. That is not as unified as having sort of, one big message across the nation, but it allows each area to have the proper funding and then react appropriately for the amount of cases in their area. It's actually a very logical response, and I have to say, he's been pretty good about being as neutral as possible. Even when Dr. Fauci slammed Trump and he was asked about it, he dodged and said, well, the facts will speak for themselves. See how he's kind of backing away. So I really respect his opinion. So far throughout this pandemic, I found him to be relatively on point. So I respect this opinion. Let's keep watching a little bit here and see what else he says.
We're going to need to support states that have to take that targeted action, try to get compliance with things like masks. So I think the bully pulpit is very important.
Quickly, sorry I keep interrupting. Masks. I just want to make this so clear. Every time we hear masks, half of us roll our eyes. We go, look, TikTok says masks aren't effective. We know masks aren't that great in some circumstances. I really want to just clarify this discussion. There are the crappy masks, the little ones that you buy on Etsy that are cool and pretty that basically fall off your face and have no filtration capabilities at all. They're just these little cloth layer things. Those are like 10 to 15% effective. There's no surprise people are still catching COVID. There's no surprise why South Korea is dominating this, because those folks in South Korea are almost all walking around with N95 respirators that are like 90% effective. So when we're talking masks, I really wish in the United States somebody would just come out and say, every single person in America gets issued an N95. If you want to wear the N95, you will be 90 to 95% protected. That's the kind of stuff that we need. Instead, we're talking, oh yeah, make a bandana yourself. It's nowhere near as good.
National leadership trying to galvanize collective action to try to reduce the spread. You're right. Once we ensue with this over the next 2 months, this is largely going to play out over the next 2 months. By the time a president is re-inaugurated in January, whoever that is, we'll probably be through the most acute phase of this, be coming down the epidemic curve. So this is really going to play out under the president's leadership. What he does over the next 2 months is going to be very important.
So
he just basically mentioned there, it's not going to be on the election to deal with this pandemic. It's on Trump.
Joe Biden, I know you've looked at his plan. If he wins, he comes in at a period of time in January where we might be on the downward slope here. What needs to happen in that November, January timeframe, regardless of who is president? And are we in a scenario where Congress just, none of what you're saying needs to be done gets done? I mean, what does that look like?
Okay, that's another stimulus question here. She's asking, what happens if in November and December and through January, Congress sits on their butt, Mitch McConnell says, we'll do a smaller bill in the first part of 2021, and nothing ends up happening? Question goes to Dr. Scott Gottlieb.
Look, Joe Biden's talked, the vice president's talked about trying to get testing out more accessible to consumers. I think that's going to be very important. I think at that point we should be trying to prioritize open schools in the late winter or early spring. We're going to have an opportunity to do that.
Close again?
I do not think. I think schools that are open right now might be able to find ways to stay open. I think schools that are closed right now, we have to prioritize trying to get them open. There's a lot of evidence now that the schools can be safely opened if they take prudent steps. That should be our number one priority. I think if Biden were to come in, that should be a focus, trying to get targeted resources, proper PPE to teachers, testing in schools that can't use social distancing, trying to get those resources into schools so schools can open. Also reporting on what the collective experience has been. If you can put out more information about what's worked and what hasn't in terms of keeping schools open, that's going to reassure more districts about opening. That should be a very high priority for this nation. Unfortunately, I don't think it hasn't been. We've been talking about it, but we haven't taken the actions to actually facilitate it.
I want to play a bit of...
Okay, let me clarify what he just said there. So, basically, we need Congress to provide more frickin' money for testing. We've literally heard this for 5 frickin' months now. It's a pisser, honestly. This Congress sucks. More PPE. How hard is it? Why is it that you see medical professionals are having to reuse N95 respirators 5, 10, 20 days in a row? It's absolutely absurd. Ramp up production. Use the Defense Production Act. Ramp up production of masks that actually matter, and send the National Guard to hand them out to everyone. I believe wearing an N95 is the kind of mask to wear. All the other crap that falls off your face, the little cloth stuff, I think is a waste of time. There are some benefits, don't get me wrong. Some benefits, yes, it helps limit some of the spread. But the respirators, that's where money's got to go. So testing, getting schools open, the PPE, so people actually have the correct masks. Again, not the cloth crap. Testing in schools, resources, and this was an interesting one. We haven't heard this before. A communication infrastructure to make it so that we can actually say, hey, we're over here in Broward County, Florida. This is something that we found has been really effective in our school. California, what do you guys think? Do you want to know how we implemented this? And communicating like that. Not a bad idea. That's not something I've heard before. I think that's a great idea.
For you from something President Trump said at a rally this week.
Oh, and keep in mind, he said that kind of communication is not currently happening, at least not on a national scale.
You know, our doctors get more money if somebody dies from COVID. You know that, right? I mean, our doctors are very smart people. So what they do is they say, I'm sorry, but, you know, everybody dies of COVID.
It sounds like the president is saying there's some financial incentive for doctors to manipulate COVID data. Or they're making money off of it.
I think it's troubling to suggest that doctors are manipulating the data to try to get higher reimbursement. The CARES Act, which the president signed, provides for additional money, about 20% more money for a COVID pneumonia case than a regular pneumonia case. The reason was because it's more expensive to take care of these patients in the hospitals. The hospitals are bleeding money. This was a way to try to get them more resources. But you have to have COVID and you have to have pneumonia, and it has to be documented. Any doctor that would be documenting COVID pneumonia in a case where the patient doesn't have pneumonia, that's fraud. Also, CMS implemented measures to try to encourage hospitals to do more testing inside the hospital. So the testing that doctors are doing in the hospitals is because the government has encouraged them to do that testing. But the only additional money is if you have pneumonia and you have COVID. That's not these patients that they're talking about that happen to come in with another condition and have COVID. There's no additional reimbursement for that.
That's interesting. I have not heard that yet, and that is actually a very interesting perspective. He said you only get extra money as a hospital if somebody has COVID and pneumonia. As in, you do not get extra money if somebody comes in and says, I have heart disease and I have COVID. I, am dying of cancer and I have COVID. There's no extra money for that, although that has been portrayed in the media. And so I'm not fact-checking Dr. Scott Lee because I don't know. I'm kind of taking his word for it on this.
He's telling him that.
I think unfortunately, I think there's probably advisors telling him that. I don't think the president derived that on his own.
It is so.
Okay, folks, that's the end of this segment. Thank you so much for watching this. If you like this, you found it helpful, please consider subscribing. If you want to see what mask you should wear, go to meetkevin.com/masks. Masks with an S. And then you will see my opinions and thoughts on N95 respirators, P100 respirators. And again, those are more so if you're actually an at-risk individual. I'm not saying everybody has to walk around with a gas mask all the time. Don't think that at all. I'm not even saying that for anyone. Anyway, thank you so much for watching. Please consider checking out those other videos. Share the video if you liked it. And folks, we'll see you next time.